Injury recall technique is a method that we can use to help get rid of the after effects of old injuries, which could be like sprains or breaks, or they could be invasive medical or dental procedures such as gynecological surgeries, laser eye surgeries, or root canals. I'm going to show you some examples of before and after changes that take place when we do these procedures. So Cecilia had a gynecological procedure, a surgical procedure, and we're going to see if we can get an increase in the range of motion in her hip by using injury recall technique to treat it. So first, if you don't mind, just touch the area where the procedure was done and hold the arm for me. And now tilt the head backward. This is how we get the body to show the injury as being significant even years later. Okay, now we're going to do a different kind of test, a range of motion test with the hip. And if we take the leg out to the side, before we treat the area, we've already got a pretty good range of motion there, about 90 degrees. Now we're going to treat the area through one of the procedures we have for that. Then if you tilt the head backward again, hold the arm for me, and now no longer weak. We'll see now if the leg goes further on the second run. So we're taking the leg out to the side, and that's dramatically more range of motion. Okay, that's wonderful. And sometimes if somebody's got several injuries or several invasive procedures that have been done, even if they've been beneficial to the patient, and we get the second one, we'll get even more range of motion. And I understand you had an injury to your foot also. Can you bring the foot up to where you can reach it with your hand? There we go. So let that bend and grab the place that got hurt. You landed hard on that foot and probably sprained some of the joints in the foot. I'm just going to use this arm as a test. So you push toward the window, I'll push toward you. And again, tilt the head backward. And it says, absolutely, that's an issue for you. I'm going to treat this now and see if we go even further afterwards. First of all, did we successfully treat the foot? If you tilt the head back again and hold the arm, yes, now we're strong. Now you can let go. And we'll see how far the leg goes now. And that's pretty remarkable. Wow, that's great. So, thank you. That's very interesting to see. Terry has had some root canals along the way, and root canals can really cause the body to go into a state of contraction that it doesn't recover from unless we do this kind of procedure, the injury recall technique. So to test it, Terry, can you touch one of the places with your left hand where you know you had a root canal? Okay, just put the finger there. And I'm going to do a muscle test. You're familiar with these. And with a straight elbow, I'll try to push your hand toward your foot. Try not to let me do that. And push against me. Push back against me. There you go. Push, and that's good. And now tilt the head backward. That's what's needed to get this to show up. And hold. And then the arm goes straight on down. So what we're going to do now is treat that root canal after, thank you, after we see how far your leg goes to begin with. Before I missed one of these, we're going to take the leg out to the side and see how flexible Terry is now. So we're going as far as he can comfortably. That's looking like about 70 degrees, so maybe 75. Okay. So now, Terry, just put the finger back on the place where you had it. I'm just going to do some gentle movements with your head. This is one of those don't try this at home situations. If you haven't been trained in this, there's more to it than it looks like. And tilt the head backward again. Hold the arm and push. And now the arm doesn't go down, so let's just see what happened with Terry's range of motion in his left hip. And we go out to the side, And now we've gone all the way to 90. That's pretty neat. So the next thing I want to find out is if we do a second one of these on a very bad ankle sprain that he had on that side, if we go a little bit further. Do you mind now touching the ankle? Just bring the ankle up to you. Grab him. Hold the arm again. Good. And tilt the head backward. Once again. We went straight to 0. I'm going to treat that one from down here on the other ankle. Tilt the head backward. Hold again. Nice. And now you can let go. We'll see how far the ankle goes this time, how far the hip goes this time. And now we're a little bit further, maybe another 5-10 degrees. Okay, well, thank you. We're going to be testing to see if Tammy's body remembers the effect of the bunionectomy that she had many years ago. So what we're going to do is first we're going to do a muscle test, and we see that we have a strong muscle, so just push against me. Good. Now let's bring up the bunion. This was the foot that had the procedure? The right one? Okay. Oh, the right one. So can you bring this one up and just hold the place where the procedure was done? Thank you. And hold the arm again. Good. And there's no change in the strength, but if you tilt your head backward and we test again, then the arm becomes very weak very quickly. So that lets us know that this is a good one to work on. Now I'm going to do one other kind of test, which is a range of motion test in the hip. And what we're going to do is bring Tammy's leg out to the side and see how far it goes comfortably. So we're just keeping it in the plane of the table, and we're going to about 80 degrees. Okay, now what we're going to do is we're going to treat the area by having her hold it again. So just bring that back up. And actually, we don't need the arm for the moment. I'm just going to do a little procedure with the other ankle. And then tilt the head backward again. Hold for me. And now Tammy's strong. Let's just see if we got an increase in the motion. So you can let go of the leg now. We'll take the leg out to the side again. And I would say we're going noticeably further. And that's typical of this technique.
Okay.
All right, we're going to do an additional injury recall technique for the site of an old hysterectomy. So right now, Tammy's touching the area where the procedure was done. So now we're going to test the arm while touching. And again, there's no difference if you test it that way. But if we bring the head backward and we test again, then there's an enormous immediate difference. So now we're going to treat this one, and then we'll come back and see if we get an additional increase in range of motion in the hip. So we're just taking care of that. And now we're going to test and see if the hip goes even further than it did after we worked on the bunionectomy. Quite a bit.
Yeah.
Okay, that was very interesting.